My name is Andrea Morales. I am a Liberty University student, and I will be conducting a head-to-toe assessment on you, okay? I have closed the door for privacy. I have done hand hygiene by using hand sanitizer. And it's okay. Do you have any questions before we start?
Nope.
Okay. And please tell me your birthday and full name.
My name is Gabriella Molly. Birthday is July 17, 1995.
Okay, perfect. Are you in any pain right now? And is it on a scale of 0 to 10?
Nope, 0.
Okay, perfect. I'm going to do a quick set of vitals on you.
Okay.
And then we'll proceed, okay?
Sounds good.
Take your temperature, your temporal temperature real quick. Perfect, 98.4. Now I'm going to take your blood pressure.
Okay.
Is this arm okay?
Yes.
Okay, thank you. I lost the pulse at 110, so I'll pump up to 30 millimeters more. Okay, perfect. Blood pressure of 112 over 62. So, okay. Now I'm gonna go ahead and assess you.
Okay.
Take a look at you. And again, if you have any questions, please let me know.
Okay.
Okay. Alright. Now I'm just gonna auscultate your back real quick.
Okay.
Any tenderness?
Nope.
Okay. And then go ahead and breathe for me while I take your pulse. Okay, your heart rate was 62 and your respirations are 14.
Okay.
So everything looks great.
Great.
Okay. Just gonna grab my tools real quick and move on to the next section, okay?
Okay.
Okay. Now, as I begin to assess your skin, as I referred to earlier, I don't see any discoloration. Your skin is a light tan color. Good contour overall. Not seeing any abnormalities. I'm gonna just lift your sleeves up real quick. Get more of a visual. Okay. Could you bring your palms out for me like this? Okay. I do see a lesion on this side, about 3 centimeters. Okay. Perfect. So completely tan on the upper and lower extremities. Let's see here. Okay. And then for the purpose of this exam, I'm going to defer inspection of the legs and feet. Okay.
Okay.
Let me just grab some gloves.
Okay. Should I keep my sleeves up? Okay.
Yes. Okay. And I do notice some papules scattered around this extremity, as well as some on your face on both right and left side. Let's see here. Okay. Could you lift your head up for me?
Mhm.
Thank you. Okay. Could you extend your arm for me so I can take a look at the back of your arm, posterior portion? Okay. No abnormalities. Let's take a look at this side. No abnormalities there either. Okay. Do you mind if I palpate you real quick and
No,
touch you?
go ahead.
Okay. So. Okay. Any tenderness?
Nope.
No. Okay. Skin was smooth, even across full body. See? Skin was warm. Lower extremity is a little bit cooler, but not too much of a difference there. Okay. Now I'm going to just pinch your hands. Could you hold out for me?
Mm-hmm.
Skin turgor. Perfect. Resilient, which indicates a good hydration status. Okay. Now I'm just going to do cap refill.
Okay.
Okay. And normally I would also do inspection of the toenails, but upon inspection, they are round, bilaterally symmetrical, nice and pink, very good cap refill as well. Okay? No tenderness, correct?
Nope.
Okay. Alright. Now I'm also going to check the nail bed to finger attachment. So they're smooth, hard, and the nail base is firm, and even thickness across the board, okay?
Mm-hmm.
And again, I would normally do this for the toes as well, but we are deferring that for the purpose of this exam.
Okay.
Okay. Now I will go ahead and replace my gloves.
Okay.
Do you have any questions at this point?
Nope, not yet.
Okay. Okay. Hold out your hands for me one more time. Okay. Contour is less than 160 degrees, so I don't see any signs of climbing. Now I'm going to take a look at your scalp,
Okay.
and I'm going to palpitate your scalp and
Okay.
take a look as well. Okay.
Okay.
Your hair is brown. It is evenly distributed. Looks soft and silky. Notice any abnormalities there? Do you feel any tenderness as I'm palpating?
No.
Okay. Okay. Your hair is thick, has resilient qualities, and again, smooth and soft. Okay? And now I'm going to take off your ponytail and also inspect your scalp.
Okay.
Okay. So your scalp is a few shades lighter than the rest of your skin tone,
Oh.
which is normal.
Okay.
I don't see any signs of inflammation or infestation.
That's good.
I also do not see any signs of hair loss, okay?
Okay.
Here, I'm again gonna replace my gloves.
Okay.
I will now be assessing your head, okay?
Okay.
Head is normocephalic, normal shaped, appears to be symmetrical. Here, look straight ahead for me. No lumps, bumps, or steps, and no crepitus. Any tenderness there?
Nope.
Okay. Moving on to face. Facial features are symmetrical. Movement is equal. Let's see. Palpate a little bit more here. Did any of this is this tender?
Nope.
Okay. 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 So sinuses are patent and intact, no tenderness near the vestibular or temporal areas. Okay. So I'm going to be doing some more tests on you. So I'm going to test some jaw strength. So open and close your jaw for me. Okay. Again. And then close. Now push your jaw forward. Okay. And backwards. Perfect. Thank you. Perfect. I'm not feeling any crepitus, no clicks on movement or PNJ. Okay. Strength of the temporal and master muscles seem symmetrical and moving smoothly. Okay. Any questions at this point?
No.
Okay. Sensation and muscle function, in your face has been equal, symmetrical, and I don't see any abnormalities.
Okay. Great.
At this point, I'm going to touch you in certain points, and I want you to go ahead and let me know the location of where you're feeling this and what it feels like.
Okay. Eyes
Okay.
closed?
Yes.
Okay. Touching my left jaw.
Okay.
My left face. Right jaw. Right head.
Perfect. Thank you. Cranial nerve number 5 is intact. Now I'm going to do some more tests. Can you smile for me? Perfect. Okay. Puff your cheeks. Put tongue on one side, on the right side. And then
Outside my mouth?
no, inside. Okay, other side. Okay, raise your eyebrows for me. Lower your eyebrows. Perfect. Okay. So for cranial nerve number 7 is intact. What I observed was that your facial muscles were moving normally and symmetrically. Okay. Okay. Now for your eyes, eyebrows appear to be symmetric. They are thick and coarse. Let's see here. Extend beyond the outer surface of the eye. Any tenderness?
Nope.
Okay. Eyelashes are also brown, evenly distributed, symmetric. No abnormal discharge or swelling are present. Okay. I'm gonna pull your eyelids down, okay? Close, open your eyes. Conjunctiva is clear. Everything is like pink. It's clear. Sclera is white. Okay. Any issues with vision?
No.
Okay. Let's see. Okay. Now I'm going to assess your cornea.
Okay.
Using this light.
Okay.
Ready? Okay, stare ahead. Cornea is clear and free of abrasions or any debris. Okay. Your anterior chambers are free of debris and there's no signs of discharge, swelling, or any redness.
Sweet.
Okay. Let's take a look. There's no appearance of a sunken eye or protrusion, which is awesome. And then again, the iris is round. It's light green in color. Let's see here. And then I'm gonna palpate your eyes a little bit now, okay?
Okay.
So I'm feeling for the lacrimal sac and gland area. Appears to be normal. No swelling. Any tenderness there?
Nope.
Okay. So the lacrimal sac and the lacrimal glands were completely normal.
Okay.
Okay. Again, no exudate, no edema whatsoever. Okay. So moving on, I'm going to test your pupils now.
Okay.
So again, with this light, stare straight ahead for me. Okay. One more time. The other side, please keep looking straight ahead. Okay. Okay. Per lights noted, pupils are equal, round, reactive, no problem whatsoever. They're constricting and converging accidentally. Okay.
Okay.
Let's see here. I'm gonna do some visual acuity test.
Okay.
Normally we do have a chart that we take a look at for the purpose of this exam. We are going to defer that.
Okay, sounds
Okay.
good.
Okay. But normally, to explain the test, we would normally have several lines of vision, and then we would go from largest to smallest. Okay. But today we are going to do the confrontation test.
Okay.
So go ahead and cover one eye for me. Okay, perfect. Okay. So now, can you see this?
Yes.
How about now?
Yes. Yes.
No. Perfect. Let's do the other eye.
Okay.
Okay.
Yes. Yes.
Perfect. Cranial number 2, optic nerve is intact. Now for your extraocular motor function, we're going to do another test. Are you familiar with this?
Nope.
Okay. So we're going to do 6 corners of gaze.
Okay.
So take a look at my finger.
Mhm.
Don't move your head. Only move your eyes. Ready?
Mhm.
So keep still. Perfect. Wonderful. Perfect. Okay. So no nystagmus was noted.
Okay. Good.
Next is the coil light reflex.
Okay.
So just stare right at my finger,
Mhm.
and I'm going to shine this light on the bridge of your nose, okay? Perfect. The light converges and reflects symmetrically on both eyes. Okay? So again, one more test. Cover one eye, stare at the wall behind me. Okay? And then with your eye covered, look at this wall to your side. Perfect. Okay, keep looking, and then remove your hand when I tell you. Okay? Move your hand. Perfect. So both eyes are tracking. Cranial nerve 3, 4, and 6 are intact. Okay? So at this point, I'm also going to do an eye exam on you.
Okay.
Okay? Alright, so that pen light's not working, so we're going to do this one instead. So I'm going to shine this light directly at the one eye, and then you're going to look in one direction.
Okay.
Okay, so go ahead and go this way. Okay. This way. Perfect. Lens is clear. Your arterioles versus venials are equal. And then let me take a look here. Optic disc is nice and yellow. Equal diameters and equal and defined margins. Okay. And then in this case, we tested both eyes, but for the purpose of the exam, it was either or that's okay with, okay? So now, I'm going to continue with my exam.
Okay.
Nose appears to be midline, standard proportion to facial features. Notice no abnormalities. Okay. No bumps, no lumps. Let's see. Okay. And then I palpated your nasal areas and sinuses earlier, so those all seemed normal. Now I'm going to actually palpate the bridge of your nose, okay?
Okay.
Did any of that hurt?
Nope.
Okay. Nose is smooth, firm, no abnormal bumps or lesions.
Okay.
Okay. So now I'm going to have you cover one nostril and breathe in for me. Okay. Switch sides.
Some bookers
Perfect. So both nares are patent, and I'm not noticing any abnormalities in your inhalation as well.
Okay.
Okay. So now I'm going to look in your nose. Okay.
Ooh, you get to see the buggers.
Let's see here. All right. So septum is midline. There are nasal hairs noted. No abnormal blockages. No moist exudate present. And the turbinates do not appear enlarged. Okay. but they are slightly a shade darker than the rest of the nose. And again, the septum is intact, midline, and not deviated. Okay. Now, I'm going to do another test and where I'm going to check your smell, okay?
Okay.
So I ask that you close your eyes at this point. I'm going to give you 2 scents,
Okay.
and you're going to let me know what you smell, okay? Closing one nostril. Go ahead and smell.
Mint.
Perfect. Yeah. And then let's do the other side.
Okay. Rose.
Perfect. So, your olfactory nerve was intact as you identified correctly what the sense was, okay?
Okay.
Now I'm going to check your ears,
Okay.
okay? Okay. I'm going to be checking your ears just a few times, okay?
Mhm.
Okay. Let me just adjust my tool. Okay. Let's see. The color of your ears and master process are the same color. Look even throughout. They are equal in size and shape, so similar appearance. And anatomical structures appear to be bilaterally symmetrical. They are in line with the outer campus of the eye. Let's see. Now I'm going to point out and palpate the structures of your ear, okay? So we have the antihelix, lobulo, tragus, the conchia. Okay. And those appear to be normal and symmetrical. Okay? Do some more palpation. Did any of that hurt?
No.
Okay. Structures are firm, mobile, and good recoil. Okay? Now I'm going to be looking at your ears one more time.
Okay.
I'm going to pull your ear up and back. Okay. Time. Any tenderness as I'm doing this?
Nope.
Okay, so when I looked in the external meatus area, I noticed some small fine hairs. There's no tenderness, redness, or like you said, no pain noticed. Let's see here. And then the pars tensa was placed in the inferior position. Let's see. And then the pars flaccida was in the superior position as well. The cone of light was 7 o'clock position for the left ear, and then for the right ear, 5 o'clock, which was excellent, all normal. Okay. Tympanic membrane was intact on both ends, and I did not notice any abnormalities within the ear or and the external portions of the ear. Okay. So moving on, I'm going to be doing 3 hearing tests on you.
Okay.
The first one's the whisper test. Okay. So plug one of your ears for me. Okay. And then I'm going to step to your side like this and say 3 numbers, and then I just want you to repeat them after hearing them.
Okay.
Okay.
2, 3, 5.
Perfect. Okay. 5, 6, 7.
5, 6, 7.
Perfect. Okay. So your post-hearing test is unremarkable. You did excellently.
Okay.
Okay. So now I'm going to use my tuning fork.
Okay.
Let's see here. Okay. So I'm going to place this at the base of your skull, and I need you to tell me if you hear it on one side better than the other.
Okay. I hear it equally.
Wonderful. So that test is negative. Now for the next test, I'm going to use this again, and I'm going to put this on the bones behind your ear, and then we're going to time this. Alright, and then I'm gonna put this behind there. You're gonna hear it, and then when it stops, let me know
Okay.
at what point you do hear it, okay?
Okay. Stop.
Okay. So that was about. I'm used to having my watch on my wrist. Okay. So air conduction test was greater than bone conduction test by a 2-to-1 ratio. So the acoustic nerve is intact. Okay. So now moving on to your mouth. I'm just gonna grab one more tool. Let's see, distinct vermilion borders, lips are pink, smooth and symmetrical. There is a metal piercing at the bottom lip. Go ahead and open your mouth for me. I'm gonna use my light here. Okay. Buccal mucosa is pink, nice and red, very moist.
Tongue
Okay.
in or tongue out.
Let's see here. Now I'm going to go ahead and use the tongue blade
Okay.
and look inside. Let's see. Okay, molars are in line. Okay, no calculi is noted. I'm gonna palpate just a little bit. Okay, open up. Okay, I'm gonna count your teeth real quick. Okay,
I'm missing teeth.
okay, again, no calculi noted. Total of 22 teeth. What I'm seeing from there, everything is unremarkable. Your dental aspect of your mouth is nice and moist. Blood vessels look healthy. No abnormal redness or swelling or any discharge or any abnormalities towards the back of the throat. Go ahead and open up again, and this time we're going to do the test where I can watch your uvula. Okay?
Oh, okay.
Go ahead. Okay, perfect. Normal movement with that. Okay. Now I'm gonna go ahead and palpate the inside of your mouth.
Okay.
I'm gonna feel your gums and your buccal area. Okay. Okay. Perfect.
I'm
Thank
at the
you.
dentist.
I'm gonna go ahead and change my gloves, but everything was intact. Again, no abnormalities. Your teeth, again, ivory, nice tight spacing. Like you mentioned, you do have 2 missing teeth, which is why we counted 22. But everything else seemed normal and appropriate. No abnormal bumps, lesions inside the buccal mucosa as well. Everything was moist, pink, and healthy. And then again, no calculi or infections noted within the gums. No abnormal swelling or tenderness, right?
Okay. Yep.
So, open your mouth one more time. Okay, and you observed earlier that the uvula was light pink, mucosa was healthy. Let's see here. I'm just gonna palpate while you stick out your tongue. I'm going to take a look. Okay. Tonsils are +1. Color is pink and blends in with the color at the posterior pharynx. Okay, so, okay, let's do some light palpation. Okay, and then open up again. And like we observed again before, soft palate moves naturally and normally. Okay, and then go ahead and swallow for me. Perfect, okay. So, nerve number 9 and 10, glossopharyngeal, are both intact, okay? So now go ahead and move your tongue side to side for me. Okay, perfect. Now cranial nerve number 12, the hypoglossa is intact. No abnormal movements there or protrusions, abnormal protrusions of the tongue.
Okay.
Okay. Place these up here. and take a look at your neck. Let's see here. Anterior, posterior sides. Holds the head still in midline. No any abnormalities. No visible lymph nodes noted. Okay. Just gonna palpate a little bit more. Okay, no masses noted. Cervical spine crevices are aligned, and paravertebral muscles are bilaterally symmetrical. Okay. I'm gonna palpate for some more lymph nodes now. Right there, close circular. Okay. Submandibular lymph nodes. Okay. Anterior, close cervical, and then deep cervical chain. Okay. I was not able to palpate any lymph nodes, which is perfect. Okay.
Yep.
Now go ahead and shrug your shoulders for me. Okay. Lower, and now against resistance. Now bend one side and bring the shoulder up. Okay. Other side. And then again against resistance on this side. Okay, perfect. Let's see here. So muscles are strong against resistance, and this tells us that the spinal cranial nerve number 11 is intact.
Okay.
Okay. So now I'm inspecting your trachea as I look at your neck. It appears to be midline. And looks symmetrical. Now I'm going to palpate it, okay?
Mhm.
Okay. And no tracheal tug noted. Any tenderness there?
Nope.
Okay. Now I'm going to head and inspect your carotid arteries, okay?
Mhm.
See slight pulsation. Now I'm going to palpate each one. Okay. Regular rhythm and no abnormalities. Now I'm going to assess for bruits with my stethoscope, okay? With the bell of my stethoscope. Okay. Okay. No bruits, and everything is 2+. Now I'm going to assess your thyroid. Go ahead and lift your head up and swallow for me. Perfect, okay. No abnormalities there. Go ahead and swallow. Okay, tilt your head down. Perfect. Tilt your chin inwards a little bit more. Okay. And then put your head straight again. That way. Okay, other side. Did any of that hurt or cause any pain?
Nope.
Okay, thyroid appears to be smooth, symmetrical on both sides, and butterfly shape. I didn't notice any enlargement of the thyroid. Let's see here. Okay. And now I'm going to auscultate for bruits of your thyroid with the bell of my stethoscope. Okay. And no bruits were noted. Okay. Now I'm going to assess your lungs. So if you are comfortable with removing your shirt, I'm going to stand behind you and go ahead and do the assessment.
Okay. Just take the whole thing.
It's if you want to, you don't have to.
Okay. Lift it up.
You can lift it up. Okay. Okay. Let's see. So color is consistent. Just gonna move your hair
Yeah.
here. Okay. No abnormalities noted. Okay. That was our short respiratory test. So I'm just gonna take a look at your chest wall here. Not seeing any abnormalities. Okay. Lift your arms for me, please. Up, all the way up. Perfect. Okay. seeing any bulging or any masses. Okay. Now I'm going to percuss some of your lung fields on your back, okay?
Okay.
So cross your arms for me and bend forward. Okay, perfect. Okay, perfect. On percussion, your lung field for resonance, loud intensity, low pitch, and long duration, and a hollow quality, all normal.
Okay.
Perfect. Okay. Now I'm going to auscultate your lungs fully.
Okay.
Okay. Again, cross your arms for me and lean forward. Using the diaphragm of my stethoscope, I'm gonna have you breathe. Okay. Sit up straight for me.
Yep.
Okay. And then I'm gonna listen to the anterior lung fields. If you could lift your arms up for me.
Up? Up?
Yeah.
Okay.
Sorry if it tickles.
Sorry.
Okay. The other side now. Okay. Perfect. And then I'm just gonna palpate real quick. Any tenderness? Okay. Here?
No, it just tickles.
Okay. Okay. And then any questions at this point?
Nope.
Just gonna change my clothes real quick. Okay. Donning new gloves. To review, your lung fields were
Okay.
all symmetrical.
Okay.
Sounded really well. Okay. Now I'm going to assess your heart. So if you could lift your heart up, your shirt up real quick.
Yeah.
I'm going to inspect your precordium. Okay. So not seeing any heaves, lifts, or thrusts. Sorry. Let's see. I'm going to palpate this area a little bit. Okay. Any of that hurt?
Mm-mm.
Okay. Not feeling any thrills or extra pulsations. Okay, and I'm gonna palpate the picture line. Okay. Let's see. Midclavicular line, 5th intercostal space. Okay. Now I'm going to listen to your heart sounds with both the belt and the diaphragm of my stethoscope.
Sure.
I'm going to start in the mitral area. So this is your 5th intercostal space, midclavicular line. Okay, moving up and over to the tricuspid area. This is your 4th intercostal space, left sternoporter. Okay. And then moving up to the 3rd intercostal space, to the Erb's point. Okay, and then I'm just going to go through here, moving up to the pulmonic area. And switching to the diaphragm. And moving over to the aortic area, 2nd intercostal space, right sternal border, and then switching to the bone. Okay, So with my diaphragm, I was able to hear S1 and S2 sounds, no S3 or S4 sounds. With the bell, I didn't hear any murmurs or any other abnormal palpitations or rhythms.
Okay.
So now I'm going to feel your pulses. First, your brachial pulses, your radial, your popliteal, and your posterior tibial, and your dorsalis pedis. Okay, perfect. And all of these pulses were bilaterally symmetrical with a regular rhythm. Okay. Now I'm going to assess your abdomen. So if you could lay down for me. Okay. So I'm gonna lift your shirt up. Upon inspection, it's a pretty even color, contour, no pulsations, no bulges or masses. It's symmetrical in the lateral aspect. Let's see. Umbilicus is midline, centrally located, looking normal. Let's see here. Contour again is flat. Let's see. Lift your head for me. Perfect. Lay back down. And I didn't see any hernias up here. Okay. Let's see here. I do see another palpule, and again, everything else looks normal and where it's supposed to be. Now I'm going to auscultate for vowel sounds. And then friction rubs as well with the diaphragm of my stethoscope.
Okay.
Okay, now over the liver. And over the spleen. Okay, vowel sounds are active with a rate of 5 to 35. No friction rubs over your liver or spleen. Okay, now I'm going to listen to any, to your arteries, your abdominal arteries, with the bell of my stethoscope. Okay. So beginning with the aortic. Renal. And iliacs. Okay. Any pain or tenderness there? Okay. Now I'm going to auscultate, okay? Tympani was heard over the stomach and intestines, and then resonance over the bladder area. Okay, I'm gonna palpate. Any pain or tenderness?
No.
Okay. Stomach is smooth and soft. No bulges or masses noted. Now I'm going to palpate for your kidneys by grabbing the sides and pinching them in between. Any pain there? Okay. Okay. Kidneys are feeling smooth, round, and small. Now I'm going to palpate your liver as well, okay? So go ahead and take a deep breath and cough. Okay. Liver's feeling firm and smooth, no pain there or tenderness, right? Okay. Go ahead and sit up for me. Okay. Now we're going to assess your musculoskeletal system.
Okay.
So go ahead and I'll have you stand on this side. Okay. Go ahead and stand facing me.
Oh, yes.
So I'm going to inspect your shoulders, your arms, your elbows, your wrist, fingers, legs, knees, and ankles and toes.
Okay.
So, looking at your neck and your spine. Go ahead and bend down and touch your toes. Okay. Then come back up slowly. Okay. On inspection, your spine and neck are aligned. Shoulders and spine have a normal contour. I didn't see any signs of scoliosis, kyphosis, or lordosis. Let's see here. Okay. So shoulders, hips, knees, and ankles all seem to be sturdy and symmetrical. No abnormalities there. Now I'm going to palpate the joints a little bit further. Okay. Okay. Any pain or tenderness there?
Nope.
Okay. Okay. No temper change or crepitus notice over the joints or muscles as I palpated. Okay.
Okay.
Now I'm going to check your range of motion.
Okay.
So we're gonna step over here. Starting with your neck in here for me.
This one. Where?
Okay, there you go. So neck down. Perfect. Back up. Now side to side. Okay. Now rotate. Perfect. Now I'm gonna do this with pressure. So go ahead, try to bring your head down. Okay. Look back up. Backwards. Okay. And then turn this side. Okay, perfect. And then tilt the head. Tilt, yes. And then the other side. Okay. Now, touch your toes one more time. Flexion. Okay, stand back up. We have extension. Now I'm gonna hold your hips, and you're gonna do hyperextension. So lean back. Perfect. Thank you. Okay. Now we're gonna do lateral bending. So side to side. Perfect. Okay. And then normally we would test all of these against resistance, but we're gonna defer that for the purpose of this exam. So bring arms up. Okay. Shoulder extension. Then flexion. Hyperextension. Perfect. Okay. And then abduction. Okay. Now bring your hands in and inwards. Perfect. Abduction. And then all the way out. Adduction. Okay. Now we're going to do the same thing against resistance. Okay.
Okay.
So go ahead and try to bring them out. Okay. And now I'm going to go put your hands on here and then try to come in. Okay. Perfect. Okay. And now we're going to do the elbows. So flex your elbows for me. Perfect. Okay. Rotate. Awesome. And then come down for extension. And then you have supination and pronation. Perfect. Okay. Perfect. So we'll do tightening of the fist and rotate the wrist. Okay. And so now we have flexion. And we have extension. Sorry, hyperextension. And then flexion. Okay. And then ulnar deviation and radial deviation. Okay. And then we're going to do the fingers real quick. Okay. So flexion, extension, and hyperextension. Okay. Perfect. And then we're going to do opposition where you're touching each finger to the thumb. And then touch the base of your pinky. Okay. And now we're going to do abduction where we put our fingers together. Perfect. And then abduction. Awesome. So now we're going to do this against resistance. Okay. So try to flex your fingers upwards while I push down. Okay. Now spread your fingers while I try to squeeze them together. Okay. Now I'm going to put my fingers in between yours, and I want you to squeeze your fingers closed. Perfect. Thank you. Now try to grab my fingers with fist and squeeze. Okay. And then hold your arms up for me a little bit more. Perfect. Again, all normal movements. So now we're going to do hips. Okay. Go ahead and put your arms down for me. You need to take one leg and try to extend far back. Perfect. And then the other side. Okay. Perfect. And I'm going to have you go ahead and lay down. Okay. Let's do leg up in the air. Perfect. So we have extension, flexion, extension. Now up. Perfect. Back down. Okay. Now we're gonna do the leg out towards that way for adduction, and now inward for abduction. Perfect. Any tenderness or discomfort there? Okay. Now do the same against resistance. Okay. Perfect. And then upwards. Okay. Perfect. Okay. And then spread your legs open a little bit and then put them together. Perfect. Now we're going to do for rotations of the hip and knee, okay? So go ahead and bend and then rotate this way. Perfect. And then outwards. Okay. And then down. Other leg. Internal rotation. External. Okay. And back down for the extension of the knee. Ready? And now I want you to straighten your legs. Okay, perfect. And then any tenderness here? Nope. Perfect. So all of these assessments again are to test your musculoskeletal exam. Now we're going to do our toes. So point your toes towards your nose for flexion. Okay, point them towards the floor. Perfect for plantar flexion. And then now point your toes together for inversion. Okay, and then eversion. Perfect. Okay. And then against resistance, I want you to point your toes to your nose. Okay? And then opposite way. Perfect. Any pain in those movements? Nope. Perfect. Okay. Your range of motion was equally bilateral, and your muscle strength was symmetrical on all sides. Okay. Muscles appear to be strong against resistance, so everything seemed normal and very well. Gonna don some new gloves. Okay, so you can go ahead and sit up for me. So we've already established that you know who you are, you know where you are, you've answered questions and followed commands.
Mm-hmm.
So just to reiterate, do you know what year it is?
2023.
Perfect. And do you know where you are?
In St. Joe's Hospital.
Perfect. Okay. And then if you saw an address envelope on the floor with a stamp on it, what would you do with it?
Real?
Perfect. Okay. Awesome. And then if you had prescription pills that you need to take every morning, what would you do?
Take it every morning.
Perfect. Perfect. So mental status is alert, oriented times 4. You appear to be well groomed. You're sitting, you're calm, you're attentive. So therefore your appearance and behavior are appropriate. You are able to speak clearly and articulate well and understand questions and conversation, as well as follow directions. Therefore, your cognitive ability is not impaired. Okay? Your responses to questions are realistic and appropriate, so your judgment is not impaired. Okay? So moving on, we're going to do a few more tests.
Okay.
Let's see here. Actually, stand right here for me.
Okay. Can I put my sweater on, or do you
Yes,
need me to
go ahead.
Just a little chilly. Okay.
We're going to do a quick Romberg's test.
Okay.
Let's see here. Okay. So stand right there. Close your eyes. Just stand there. Okay, perfect. That was the Romberg's test, and it was negative. There was no indication of you swaying or falling over.
Okay.
Come to me this way. Okay. Now turn around and walk towards the wall. Okay. Gait appears to be smooth, mental regular rhythm, no abnormalities. Now I would like you to walk heel to toe from your location.
Oops.
Okay. Perfect. Thank you. So that appears to be normal. No abnormalities there. Okay. Now we're going to do alternating rapid hand movement. So go like this. Perfect. And now we're going to do another test. So this. Perfect. Okay. So take one heel now and run it down your shin. And then switch the foot the other way. Perfect. Okay. So you're able to move accurately without any deviation of the heel. Therefore, your cerebellar function is intact. Okay? Go ahead and have a seat for me now. Now we're going to be checking your sensory function. So, okay. So, I have two things. One is going to be sharp, and the other one's going to be dull. So while your eyes are closed, I'm going to put this on your different body parts, and you're going to tell me what you're feeling and where they are.
Okay.
Ready?
Sure.
Okay, good.
And on my arm. Dull on my left leg.
Perfect.
Sharp on my right leg. Dull on my right arm.
Perfect.
Sharp on my left leg. Sharp on my right shin.
Perfect. Almost done.
Skin. Sharp on my right wrist.
Perfect.
Dull on my. Sorry, I said left. I meant left. This one's the right.
No problem.
Dull on my right
Okay.
hand.
Ready? Our assessment is almost coming to a conclusion, so do you have any questions at this point?
Nope.
Okay, so we have a few more assessments that we're going to do.
Okay.
I'm going to put certain objects into your hand and see if you could tell me what these objects are with your
Okay.
eyes closed. So with this hand, so to reiterate, the test we just did was the superficial touch and superficial pain exam. So now we're going to put these in here. Go ahead.
Can I feel it with both hands?
Just one.
It's like a hair clip.
Perfect. And then with the other hand,
Feels like a needle.
perfect.
Ah.
Thank you.
Sorry.
Okay. No, not a problem.
Just thought
So,
that's funny.
Let's see here.
Random
Go ahead and
objects.
open your eyes. Okay. So now I'm gonna put this tuning fork on a bony prominence, and you're gonna tell me when you feel it and then when it stops. Okay.
Okay.
Okay. This is the vibrations sense test. Okay.
Okay. And it stopped.
Okay. And then the other side. Perfect. Okay. Now your hands. Okay, close your eyes. Is this up or down?
Up.
And this?
Down.
What do you feel here?
Even. Neutral.
Perfect. And then this side?
Down. Up. Neutral.
Okay. At this point, I'm also going to take your palms, keep your eyes closed. I'm going to draw a number on one side and a letter on the other side, and you're going to tell me what was drawn, okay?
Okay. Are you drawing it facing me or facing you?
Facing me. Okay. So, drawing the number here.
7.
Okay. And then this hand.
P.
Perfect. Okay. Okay, you can open your eyes for me now. Okay. So for all these neuro tests, if applicable, we normally do more extremities, and on this case we were able to do bilateral. So now we're gonna do reflex testing. Okay.
Oh, okay.
So starting with bicep reflex. Don't watch me. Stare at the wall or something else. Ready?
Mhm.
Okay. And now your brachioradialis reflex. Okay. And your elbow over here for your triceps reflex. Just limping. Perfect. Okay. And then come forward on the table a little bit. Perfect. Do the patellar reflex. Okay, go. And then go ahead and stand up for me. And then can you get back on the table with your knees, with your ankles hanging off, so we can do your Achilles reflex. So turn around. It's okay.
Picturing that differently. Like this?
Yes. Okay. Ready?
Yeah.
Perfect. Okay. You can go ahead and take a seat. So all your reflexes were a +2. Everything was normal and super responsive. So this concludes our physical assessment for today. Thank you so much. You did awesome.
Thank you. Pleasure doing business.